Hi, Dr. Michael Lenz here. Just want to take a minute to go over ADHD and fibromyalgia. In my observation over my career, I've seen a connection between chronic pain disorders and ADHD. There was a recent study that was published in the Journal of Pain Medicine in November of 2017. And here's a general overview of what they looked at, why they looked at it, and what the results were. Fibromyalgia is a chronic pain disorder that is associated with abnormalities in neurotransmitters such as dopamine, norepinephrine, and noradrenaline. Fibromyalgia can have significant impact on a patient's suffering, and with chronic pain, fatigue, and cognitive impairment. This cognition may be more disabling than the actual chronic pain and is mostly under-recognized. This study aimed to assess the potential co-occurrence of fibromyalgia syndrome and adult attention deficit hyperactivity disorder, also known as ADHD, a chronic neurodevelopmental disorder also associated with impaired cognition and dopaminergic dysfunction. What they did was a cross-sectional study, an observational study. They had 123 previously confirmed fibromyalgia syndrome patients who were screened for adult ADHD using the World Health Organization Adult ADHD Self-Report Scale version 1.1. I'll go over that in a separate video. The revised fibromyalgia impact questionnaire, also we'll go over that in a second, questionnaire was used to assess the impact of fibromyalgia symptoms. Cognitive assessment was based on self-report in accordance with the 2011 Modified American College of Rheumatology criteria and the Fibromyalgia Impact Questionnaire revised respectively. Of the 123 participants, 45%, that's 55, screened positive for adult ADHD. Participants with both fibromyalgia symptoms and a positive adult ADHD screening test were higher on the Fibromyalgia Impact Questionnaire score with an average score of 65 versus 54 in those who just had fibromyalgia but not tested positive for ADHD. Self-reported cognitive impairment was also rated higher in the combined group with an odds ratio of 10.6. What this means is there's a high probability and connection that if somebody has significant cognitive impairment and struggles with fibromyalgia, they have a much greater chance, 10 times greater chance of also having ADHD. The results indicate that adult ADHD in fibromyalgia syndrome may be highly prevalent, almost half in this study, and may also significantly impact the morbidity, also known as the suffering from fibromyalgia symptoms. And it was recommended that fibromyalgia syndrome should be assessed for the presence of also adult ADHD. Point being, if you have fibromyalgia syndrome and you have adult ADHD, you're much more likely to have significant suffering, and adult ADHD is treatable.